All right, we are going in depth with a story from the Salt Lake Tribune. Over the last year, several groups have administered more than 3 million COVID tests in Utah. TestUtah was not the biggest. They tested just under 250,000, but they were the most expensive per test for the state, according to a Salt Lake Tribune exclusive report. Some of the details here, the basics from our friends there at the Tribune. TestUtah, run by a company called Nomi Health, did not ask patients for insurance information. They said that was their intent. It streamlined the process. That meant all of the $100 fee per test was paid by Utah taxpayers. Now, the Tribune looked into what the state paid the biggest health providers. The U of U said that they got more than half of the test costs paid by insurance, and Intermountain Healthcare says they got about 98% of their test costs from insurers. Such a huge discrepancy there. Aaron Alberti is the reporter behind the Salt Lake Tribune exclusive. Aaron, so good to talk to you. We're talking about those specifics per test, but big picture, how much money are we talking about?
Well, we calculated how many of TestUtah's tests in 2020 likely would have been eligible for insurance. And that's because insurance doesn't necessarily cover tests of asymptomatic people who haven't been exposed. So we looked only at the people who had symptoms when they went to TestUtah to get testing, counted that, and then to get a more conservative estimate, looked at what the average reimbursement was at the University of Utah, which is quite a bit lower than at Intermountain, for example, and multiplied that out and discovered that there were about $10 million that the state spent on TestUtah that likely could have been recouped had insurance been billed.
And I think that the thing that that kind of it needs to be explained, and you do go into this, is why not ask for insurance? I mean, the U of U and Intermountain tested a whole lot more people than Nomi did, and they processed insurance claims for all of those folks. So why did Nomi not ask for insurance?
Well, I should say that, Nomi's instructions generally come from the state. It's the state's contract. And the state also, supported this not seeking insurance plan. Now, yeah, the U and Intermountain and the other hospitals do seek insurance. That's not necessarily easy, however. Intermountain, for example, said that they're still processing claims from last year for testing because, COVID testing in particular, it's not the most expensive thing that happens at a healthcare provider, but it's very high volume. And that means that it just produces a lot of claims. And so the state has said that the overhead, the administrative burden would have really been unwieldy for them. Mm-hmm. Also that, it would have complicated the messaging a bit. That if they were trying to get people to get tested, regardless of whether they had insurance, to just say it's free, we're paying for it, insurance isn't even going to come up, would be more likely to get people who otherwise might not seek testing, in particular people in underserved communities, to go out and get their tests. Both Nomi and the state had that explanation.
Okay, and I think you were very polite there in correcting a little bit of my framing of this, in the sense that Nomi is contracting with the state, so they're performing a state program. That would be part. Their explanation is in a sense, it's not the active tester or the one who's putting this program in is the state hiring them to do it.
Yeah, in fact, we looked through emails exchanged between the health department and some other government officials, and one of them references Nomi, or these people with TestUtah, asking, are we going to try to get Medicare or Medicaid coverage for this, for example? And that's another thing. I mean, had they gone to Medicaid and Medicare, obviously not all of Utahns are covered by private insurance. Those who are covered by Medicaid, for example, Medicaid does pay for it. The trade-off, that the state made was by not accepting Medicaid, they instead went to federal CARES Act funding. Now, that funding is very flexible. This was a lot of money that Congress issued to the states with very few strings attached, in terms of basically it just has to be about COVID. Yeah. So instead of going to Medicaid, for example, which would be part of the paperwork issue, they used this more flexible funding that maybe could have gone to rent assistance or PPE for teachers or things that we've also needed.
Well, I mean, we know testing is important. Do they point to any evidence that shows that they achieved what they wanted in terms of reaching out to people who wouldn't have gotten help from the U or Intermountain or the National Guard? I see your cat there. That's okay. He or she can sneak in. What's that?
I think it's easy to just let him stay.
Yeah, yeah.
I'll just let him do his thing. It's okay.
Oh yeah, it's fine. So, but no, so is there evidence that they achieved what they intended to? That they reached out? That they actually got to those groups?
Well, the TestUtah has done a large number of tests. However, they hadn't done, or as of earlier this year, as many as, for example, the Utah National Guard had done at their sites that are operated in conjunction with the Department of Health. And they hadn't done as many as the U, and nowhere near as many as Intermountain.
Yeah. Okay. Okay. So this is a story that has a lot of detail. I suggest, because we're out of time, anyone who's interested in finding out more about Erin's reporting, you're not going to learn more. What's the cat's name?
Atticus.
Ooh, Atticus. Atticus Finch, but not a Finch, Atticus cat. Okay, wonderful. Hey, Erin Alberty, her story is in the Salt Lake Tribune. It's really worth reading because they're following your tax dollars, making sure they're spent well. Thank you, Erin.
Thank you.